Hello, everyone. Welcome back. Let me ask you something real quick. Did you know there was a way to use your PCT or CNA work experience to become a licensed nurse in California? Yeah, most people don't even know this exists. And if you've been working in healthcare for a while, doing patient care, taking vitals, helping with daily living, being right there at the bedside, this might be something you need to hear. Because for a lot of people, the only path they've been shown is go back to school, spend a ton of money, wait years, and hope everything lines up. But there is another pathway. It's called Method 3 through the BVNPT. And what it does is recognize something important. It recognizes experience. Now, let me break this down for you in a way that actually makes sense. Method 3 is based on equivalent education and experience, which means if you've already been working in a clinical setting, especially inpatient, you may already have a foundation that qualifies you to move forward. We're talking about individuals who have built up real hands-on experience over time. For example, if you've worked in medical surgical environments for around 3 years and 4 months, along with additional exposure in areas like pediatrics and maternity, that experience can count toward eligibility. That's a big deal, because that means your time working, your hours, your effort, they're not just going unnoticed. But let me keep it real with you. Just because the pathway exists doesn't mean it's simple. There are requirements. You still need to document your experience. Your employers have to verify your work. And you need to complete a pharmacology course that covers medication knowledge, dosage calculations, and safe administration. So, this is not a shortcut. This is a structured pathway. And this is where most people get stuck, not because they don't qualify, but because nobody has actually walked them through the process. Nobody explains what counts and what doesn't, how to document your experience correctly, how to meet the requirements without making mistakes, how to prepare for the next step, which is the NCLEX-PN. And if you're watching this, I'm willing to bet you've probably already put in the work. You've worked the shifts, you've been on your feet, you've handled patients, you've seen what real care looks like. But you haven't been shown how to turn that experience into a license. That's the gap. Not your ability, not your intelligence. The gap is structure. Because even with Method 3, you still need a plan, proper documentation, preparation for the exam, and support along the way. Because when you have the right support system, everything starts to make sense. You're no longer guessing. You're no longer trying to piece things together from random information online. You actually have a path. So here's what I want you to do. If you've been working as a CNA, if you've been working as a PCT, if you've got real hands-on experience in healthcare, and you've been thinking about becoming a nurse, don't just sit on that. Take the next step and find out if you qualify, because you might be a lot closer than you think. The easiest way to get started is simple. Call Joy. When she answers, just say Method 3, and she'll guide you from there. She can help you understand if your experience qualifies, what you're missing, if anything, and how to move forward the right way. Here's the number, 650-899-8689. I'll say it again, 650-899-8689. Listen, opportunities like this don't come around often, where your past work actually counts toward your future. So if this sounds like you, if you've been in healthcare putting in the time, this might be your moment to move forward. I'll see you on the next one. And remember, sometimes the path isn't about starting over. It's about using what you already built.